Hello everyone, welcome to HIM 216. This is the second lecture for Chapter 6, and I want you to turn to page 98 in your textbook. On page 97, it actually discusses the different body systems in the medical surgical section. We looked at those. This is what if we click on medical surgical here, these are all of our body systems. This is what's in your book. And on the top of page 98, it talks about the general anatomic region body system. And so you see this is the general anatomic region right here, and it tells us that in the guidelines, procedure codes in this system are only used when the procedure is performed on an anatomic region rather than a specific body part. It also tells us that if body parts are designated as either upper and lower, the dividing point is the diaphragm. Anything above the diaphragm is considered upper. Anything below the diaphragm is considered lower. So keep those in mind. Those are important. So when we're in the anatomic region general, we do have the option for these root operations, and it just depends on what we're trying to code. For instance, if I put in herniorrhaphy, you can see that these codes do go to the general anatomic region as well. Now, I want to show you something as well. If we go to the help section, PCS, Procedural Coding System, the guidelines are here. There is also a reference manual here. And I want you to pay really close attention to this because this is the body part key. So if you have a body part, get over here. If you have a body part, and when you're looking in PCS, you can't find that body part listed, this is an excellent resource. For instance, if you were trying to determine what body part to use for the abductor hallucis muscle, this tells you that you're going to use the character for either foot muscle right or foot muscle left. Accessory spleen, you're going to use spleen. Achilles tendon, and Achilles tendon repairs are fairly common, but you have to use lower leg tendon right or lower leg tendon left. Acromioclavicular ligament, you're going to use shoulder bursa and ligament right or shoulder bursa and ligament left. So this particular table is an excellent tool for you. It's in alphabetical order, and so if for some reason you're looking for a body part and you can't find it in PCS, come to this particular reference tool, and it's an excellent reference tool for you to use. Come on, move up for me. I'll just go back. Now, okay. Now, the other thing that we have is a definitions manual. So when you go into this definitions manual, it includes the definitions for all of these different areas. So these are the root operations. So if you wanted to print this out, this would probably be an excellent tool for you to print out, to have all of these in one place. Okay, let's see what this is. And so then we have, I went down a little too fast, I apologize. Then we have information. Okay, so we have root operations. And then we have body part, and for instance, the first toe left and the first toe right include the hallux. The abdominal muscles left and right include, and it tells you what these different muscles are that are included. The abdominal aorta includes all of these areas, all of these arteries, the lumbar artery, the ovarian artery, the testicular artery. So this is also an excellent tool that can help you when you really get into coding PCS. In reality, we'll have very few of these in this course because this is a little more advanced, but you need to be familiar with these tools and know how to get to them. There is a device aggregation table, and we'll talk more about devices. There's a specific definition for a device and specific instances when you insert a device. But for the autologous arterial tissue, the device is going to be autologous arterial tissue. These are the body systems that potentially will use autologous arterial tissue. Cardiac lead defibrillator. The root operation is insertion. The body system is heart and great vessels, and the device is a cardiac lead. So it may be that you have a device and you're not sure how to handle it. You can come to this device aggregation table and it'll tell you. So if we have hearing device, bone conduction, the root operation is going to be insertion. The particular system is going to be ears, nose, and sinuses, and then the device is a hearing device. Here's cochlear implants. So this is a great table, and again, you know, this is something that it just does not hurt to print it out and have it handy so that you can review it. There's a device key, which has specific types of keys listed, and it tells you what device character you should choose in PCS. We have a specific character that's for device, and so this tells you of those options that you'll see listed in that column which device you would use. And then there's also a substance key. And so substances are used during surgery as well, and this gives you that information. So this reference tool is excellent for you. All right, now a very important, getting back to the book on page 98, it's very important to understand that physicians do not have to use the terminology that we code by in the procedural coding system. For instance, resection and excision. Let me pick gastrointestinal. And then I'm going to click on this for the root operations. Okay, so if I go down to, or in your book, you can look at excision. And in this first set of procedures that always remove some or all of a body part, you can see that excision is cutting off without replacement a portion of a body part. The key term here is portion. So for instance, if a mass is excised from a breast, the root operation is excision because the entire breast is not removed. But when a mastectomy is done, the root operation is resection, cutting out or off without replacing all of a body part. So sometimes physicians will say that they're excising the left breast. Well, they're cutting the entire breast off, but from a root operation standpoint, they're performing a resection, not an excision. So you can't always look at the terminology that the physician uses and code specifically from that terminology. You have to be able to read that operative report and understand what's being done. If a mastectomy is done, unless they tell you it's a partial mastectomy, it's a total mastectomy. You can also look at path reports who will provide that information. For instance, in an appendectomy, if a patient has appendicitis, they don't take out part of the appendectomy. They take part of the appendix. They take the entire appendix out. So a physician may say that he's going to perform an excision of the appendix when in fact the root operation that we'll use is a resection. So your book tells you that physicians are not responsible for understanding these definitions or recording these definitions at all. It's up to you to understand them and correctly apply them. Now, when we're looking at root operations, you can see that they are, first of all, root operations are, in another book, they were actually listed beginning with like 1, 2, 3, 4, 5, and then A, B, C, D, E. But in this book, they're grouping them together. Well, actually, if you look at the at your screen, you can see that bypasses 1, changes to destruction, dilatation, division. So you can see these in the order, in alphabetical order, in numerical order and then alphabetical order. In your book, they're grouping them together by their intent. So the first group of 5 root operations are root operations that remove some or all of a body part. And these are destruction, detachment, excision, extraction, and resection. The next group are operations that remove solid fluids or gases, and so on and so forth. And so in the book, they have grouped them together to make it kind of easier to understand the intent. And I want you to look on page 99. Root operations that always involve a device. You can only use these if in fact the procedure is using a device that meets the definition of device, which we will talk about in a minute. On your test, it's actually matching, and the test is broken down into these divisions where you're similar to your textbook. So basically you need to read through these, learn these as best that you can. You don't actually have to memorize them because you'll always have access to a resource like 3M or a PCX textbook that will demonstrate these for you. Then on page 100 and 101, you are answering the odd-numbered questions for 6-3. Remember that the even-numbered answers are in the online student resources. Body part is on page 101. That's the 4th character, and this is the body part on which the procedure is performed. So if a lumpectomy is being done on a breast, the body part is the breast. And then I want you to look on page 102. 102 lists the approaches, and then on page 103 there are actually pictures of these approaches. And it's very important to understand this terminology. Open is pretty straightforward. You are cutting into a person's skin. You're cutting them open to perform that procedure. And A is an example of an open procedure. B is percutaneous, and this is a puncture or a minor incision, and the example they have here is a needle biopsy of the liver. So they actually use a needle, they insert it into the body part, they suck out tissue, and they remove the needle. Percutaneous endoscopic. Now this is when they use instruments through the skin to visualize the procedure site. And an example of that is a laparoscopic cholecystectomy. And if you look at C on page 103, This is what it looks like. They don't make a big incision, they make small incisions. They put the instruments in through the body and they are able to see them. That's the big thing here, is with an endoscope you can actually visualize the particular site. Now, number 7 is via natural or artificial opening. And I want you to look at D, because this is when instrumentation goes in through a natural or an artificial opening. So this is an example of an endotracheal intubation. So they're putting in an ET tube. Usually if a patient's going to be on a respirator, they'll put in an ET tube to hold the airway open. And this is an example of that root operation. And then number 8, if you look at E on page 103, natural or artificial opening endoscopic, and a colonoscopy is an example of this. An EGD is an example of this. So they're actually putting in instrumentation so they can see inside that natural opening. And then F is a natural or artificial opening with percutaneous endoscopic assistance. So if you look at F on page 103, this is an example of a laparoscopic assisted vaginal hysterectomy. So they're going in through the vagina, which is a natural opening, to actually remove the uterus. They are inserting endoscopic equipment so they can actually see what is going on in there, and they can cut arteries and veins and ligaments that are holding the uterus in place, and then they remove the uterus through the vagina. And then external is when the procedure is performed directly on the skin or the tissue, or like when they're applying force to for reduction of a fracture. And you can see that the example for this is the tonsillectomy. Now your book tells you that there are 3 components that determine the approach: the access location, the method, and the type of instrumentation. So read this carefully. For computer-assisted robotic surgery, there is actually a PCS code that we will apply for computer-assisted surgery. And I'm going to, in the index, if I type computer-assisted procedure, you can see that there are many options here. Don't get confused with computerized tomography. This is a CT scan, and these are actually coding to a totally different section than medical surgical. So always pay attention to the codes and make sure you're not going someplace that you don't need to be. So for computer-assisted surgery, we would actually code the procedure, and then we would have a code from the other procedures section, which reflects that we are doing a computer-assisted procedure. So for this, our body region is lower extremity, the approach is external, it's a computer-assisted procedure, and there is no qualifier. And you'll become more familiar with these as we go through many more examples when we're in Chapter 8. So don't look at this and panic and think, oh, I don't have a clue how to do this. Because in this chapter, the focus is really to get you familiar with the index, with the table, how to move around in it, what are the root operations, what are the guidelines. For this lecture, I want you to answer exercise 6.4. I want you to answer question number 1 and question number 3, and that will conclude this second lecture for Chapter 6.